Welcome to page 93 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Continuing to talk about the autonomic nervous system, the ANS, particularly this time the parasympathetic division. Para means next to, or surrounding. And recall that we've already discussed the sympathetic nervous system, which was in the spinal cord area of T1 to L2, thoracic 1, L2, lumbar 2. So the parasympathetic is the system that's next to or surrounding. So it's above and below. And the parasympathetic is not the system that's active when a lion jumps out at you and tries to attack you, or when an intruder comes into your house. That's the sympathetic. This is the opposite. This is the parasympathetic nervous system. The parasympathetic nervous system is not fight or flight. It's rest and digest. So when your body settles down from the stress, it needs to rest and digest food. And that's the responsibility of the parasympathetic nervous system. Now, take a quick review of the sympathetic nervous system. Recall that the lateral horn of the spinal cord contained the sympathetic cell bodies, the autonomic cell bodies, and they synapse at a ganglion. Remember the sympathetic chain? All along the spine, these ganglia running up and down the spine, and they went and synapsed in that ganglia, or they synapsed in a pelvic, in the a ganglia that was outside of the sympathetic system. And then there was a postganglionic neuron after the synapse, and it went to innervate the effector organ to stimulate it or inhibit it. Now, there's something different about the parasympathetic nervous system, because look how short the sympathetic, the preganglionic fiber is here, preganglionic neuron. And then we have a long postganglionic neuron. Well, in the parasympathetic system, observe the preganglionic fiber neuron is long, and it goes all the way to the organ, and the ganglia, and then it synapses at the organ, and the postganglionic neuron is very short. The unique thing about the parasympathetic system is the ganglia, where the synapse occurs, is inside the organ, somewhere within the organ, within the muscles, the smooth muscles of the organ, whereas the ganglia of the sympathetic are outside in the sympathetic chain or in the mesenteric ganglia, etc., etc. So that is a difference between the two systems, other than that they're opposites, functionally opposite, in that one is ready for fight or flight and the other is ready for rest and digest. So let's show an example of some parasympathetic neurons. And let's start up top here. Recall your cranial nerve, number 3. That's the oculomotor nerve. Here is in the midbrain, where its cell body lies in the midbrain of the ocular motor nerve cell body. And it goes out to affect these organs here of the eye. Remember, oculomotor. Oculomotor, recall that it is responsible for the muscles of the eye to move the eye, but it also has a little bit of parasympathetic responsibility too in constricting the pupils. So here's the ganglia, within the organ. Remember, I said they were within the organ in the parasympathetic nervous system. And note now the postganglionic neuron heading to the pupillary constrictor muscles of the eye, the ciliary muscles they're called. Recall that with the sympathetic system, the sympathetic stimulation dilated the eyes and opened them up to get ready for attack so you can see everything. Now, the parasympathetic system will take a wide eye pupil and then narrow it nice and dark and small. The cranial nerve number 7, the facial nerve, lies just at the top of the medulla here, in between the pons and the medulla. The cell body lies right here, and it goes, the facial nerve. Recall that it is responsible for the muscles, some of the muscles in the face. But here, it's synapses at a ganglia that lies in the face. So to see this long preganglionic neuron, and again, a very short postganglionic neuron to innervate the lacrimal gland. This is your tearing gland that provides water for your eyes to remain moist. It also innervates the oral mucosa and the nasal mucosa, the mucous membranes of the mouth and nose inside. The facial nerve also branches off and supplies parasympathetic stimulation to the sublingual glands. Here's the ganglia within the mouth, the sublingual gland. It's for saliva, and the submandibular gland, more saliva to help you digest food in your mouth, to secrete moisture in your mouth and digestive enzymes in your mouth to get the digestion process started. Once again, that's an example of the parasympathetic nervous system being responsible for digestion. Now, parasympathetic activity in the glossopharyngeal nerve. Recall that's number 9 here, cranial nerve number 9. The cell bodies in the medulla oblongata, with the long preganglionic neuron synapsing in a ganglia inside the parotid gland. This is the gland on the side of your cheek. And then a very short postganglionic neuron to stimulate more of that saliva and those digestive juices inside your mouth. When you see a juicy steak or a piece of candy and you start salivating, that's your parasympathetic nervous system at work, getting you ready for digestion. Next is cranial nerve number 10. Cranial nerve number 10, with its cell bodies that lie in the medulla oblongata. And it's a very important nerve. It's called the vagus nerve. Very long. Look at the path it takes. It comes out of the cranium, out of the skull, heads all the way down, and has branches that synapse right here in the ganglion inside the lungs to synapse with a short postganglionic neuron that tells the lungs what? Slow down your breathing. It's okay. It's time to rest. There is no lion out to get you. Slow your breathing. It's time to rest and sleep. So thank goodness for the parasympathetic division of the autonomic nervous system to help us rest and digest. And the vagus nerve will again branch off to a postganglionic neuron. First, the ganglion inside the heart, and then a very short postganglionic neuron. What's it telling to the heart to do? What is the stimulation of the heart do? It says slow down. Lungs, slow your breathing. Heart, slow down. There's no emergency here. It's time to rest, and it's time to digest your food. Slow the heart rate down. A nice, relaxing parasympathetic nervous system. Then it'll have a branch to the stomach. The vagus nerve continues down and branches off to innervate the liver, to secrete, and then synapses here at the ganglion inside the liver. And here we have the postsynaptic neuron, stimulating the liver to make products that support digestion. And then coming off to the stomach here to stimulate the secretion of hydrochloric acid and other products in the stomach for digestion. Here we have another branch of the vagus nerve, presynaptic. Look at how long these presynaptic neurons are compared to the presynaptic neurons of the sympathetic nervous system. And of course, here we have a ganglion inside of the pancreas and the postsynaptic neuron to the pancreas, stimulating digestive enzymes that get dumped into the small intestine or the duodenum for digestion. What's the theme here? Digestion, rest and digest. Here we have another branch of the vagus nerve here, and then of course the ganglion. And the vagus nerve, and again, a long presynaptic neuron synapsing in the ganglion, which lies inside the intestine here. And you can see, of course, the shorter postsynaptic neuron. Lastly, another long presynaptic neuron synapsing with postganglionic, short postganglionic neuron to the small intestine. Again, recall that the vagus nerve started way up here in the medulla oblongata and traveled all the way down this great distance through the skull, all the way down to the intestines, to the pancreas, to the stomach, to the liver, stomach, liver, etc. So the vagus nerve travels quite a distance to have its effects on the body. Now, for the pelvic organs and some of the lower digestive organs, like the rectum and the large intestine, you see that the preganglionic neurons start in the sacral section of the spinal cord, the lateral horn, of course, and they extend out and form into a plexus called a plexus of sorts called the pelvic splanchnic nerves. Recall that the sympathetic system had splanchnic nerves. These are the same splanchnic nerves, and they're sharing their space with the parasympathetic system. And here you can see one branching off, a preganglionic, within the colon, the large intestine. And it appears that the drawing here, by the way, the small intestine is in the middle here and the large intestine is on the outside for the sake of the drawing. So part of the colon, the lower colon, the descending colon, receives innervation from the sacral parasympathetic system. So notice that some of the innervation from the intestines comes way up high from the cranial portion of the parasympathetic system. And the intestines also receive down here from the sacral portion. So recall it's the parasympathetic. It's next to the sympathetic. It's above and below the sympathetic system. Interesting that the colon receives from the vagus nerve, the cranial portion of the parasympathetic system, and the sacral portion as well. So here we go with some more sacral nerves branching off of the splanchnic nerves from the pelvic area and innervating the rectum. This is the ganglion inside the rectum. Of course, we have the synapse occurring here and the very short postganglionic neuron to the rectum. Similarly, from the sacral area here and through this plexus, receiving innervation is the kidney. There's the long preganglionic neuron, and then the short postganglion. I've kind of switched colors up on you here. The short postganglionic neurons. And again, off to the bladder, the urinary bladder from the sacral area through the splanchnic nerve to the ganglion here. And then we have the ganglion, remember, of the parasympathetic system are found in the organ itself, not in the sympathetic chain or a chain. And here's the short postganglionic to the bladder. And again here, down to the uterus, the female organs. Here's the ganglion in the uterus, and then the short postganglionic neurons or axons into the uterus. So, in summary, the parasympathetic system means next to. It means next to or on each side of the sympathetic system. Here's the sympathetic system here. Of course, this is parasympathetic and parasympathetic. The signals come from different regions of the spinal cord. Up here, the cranial region. Down here, the sacral region. That's where the signals come from. Cranial region in the midbrain pons and medulla oblongata. And in the sacral region, just the sacral regions of the spinal cord. And of course, it's the opposite. It's rest and digest. This is not your fight or flight system. This is rest and digest. And you can see now the difference between the previous pages we've worked on about the sympathetic, where it's all about exciting and preparing the body for activity, and the parasympathetic is about slowing everything down. And your terms over here. We reviewed the oculomotor nerve, cranial nerve, the 7th nerve, the 9th nerve, which is the glossopharyngeal, the 10th nerve, which is the cranial nerve, which is the vagus. Talked about the pelvic splanchnic nerve. We reviewed the fact that the ganglia are mostly inside the organs themselves, but there are a few ganglia that are in or maybe perhaps not directly in the organ, but around the organ. The otic, for example, the submandibular, right down in here, etc. If they're not in the organ itself, they're very close to the area where the postganglionic nerves will be innervating. Postganglionic neurons, we've discussed them to the eye, to the nasal and oral cavities, to the salivary glands like the parotid, submandibular, and sublingual, and the postganglionic neurons here to the thoracic and abdominal viscera. Postganglionic neurons. And how short they are. That's the interesting thing to note, is how short they are. And lastly, the pelvic and perineal viscera. Perineal means between the legs, the organs, glands, and structures, muscles and skin between the legs, deep into the groin area. And that would be these perineal type organs here, these pelvic organs. Okay, this represents the conclusion of page 93, the parasympathetic division of the autonomic nervous system. I'm Dr. Stephen Harkins. And until next lesson.